If you have PCOS, you've probably been told to just lose weight or just go on the pill. And if that's the advice you've been given, I really need you to stay till the end of this video, because as a midwife, I see women every single week who have been let down by that advice. Today, I'm going to tell you what PCOS actually is, what really is causing it in your body, and most importantly, what genuinely helps. Evidence-based, no fluff. PCOS stands for Polycystic Ovary Syndrome. And right away, I want to clear something up. Despite the name, you don't actually need to have cysts on your ovaries to have PCOS. That surprises a lot of women. The name is genuinely misleading. PCOS is actually a hormonal condition, one of the most common hormonal disorders in women of reproductive age. It affects roughly 1 in 10 women. So if you're watching this, statistically, someone you know has it. To be diagnosed, you typically need 2 out of 3 things. Number 1, irregular or absent periods. Number 2, higher than normal levels of androgens, which are often called male hormones like testosterone. Number 3, polycystic ovaries on an ultrasound, where the ovaries appear to have lots of small follicles. 2 out of 3. That's the Rotterdam criteria, and it's what most doctors use. Now, here's where it gets interesting, and where I think a lot of women aren't getting the full picture. PCOS isn't caused by one single thing. It's complex, but there are a few key drivers. The first is insulin resistance. This is huge, and it's present in up to 70% of women with PCOS. Insulin is the hormone that helps your cells absorb sugar from your blood. When your cells become resistant to it, your body pumps out more and more insulin to compensate. And high insulin signals the ovaries to produce more testosterone. More testosterone equals disrupted ovulation, irregular periods, acne, hair in unexpected places. The second driver is inflammation. Women with PCOS tend to have higher levels of chronic low-grade inflammation and often other autoimmune disorders. This also stimulates androgen production. It's a vicious cycle. Genetics play a role too. PCOS tends to run in families. And before you think, so there's nothing I can do, stay with me, because the lifestyle factors I'm about to share genuinely move the needle. Let's talk symptoms, because PCOS looks different in every woman. The most common ones I hear from my clients are irregular periods or none at all, sometimes going months without one, difficulty getting pregnant, because if you're not ovulating regularly, conception is harder, weight gain, especially around the middle, even when diet hasn't changed, acne, often on the jawline and chin, and it doesn't respond to the usual treatments, hair thinning on the head, and sometimes unwanted hair on the face, chest, or stomach, and fatigue and low mood, which often gets dismissed and isn't talked about enough. That's a whole separate video that I can do. If several of those resonate with you, please speak to your GP or midwife. You deserve answers. Now, I've been saving the most practical part for right here, because a lot of videos talk about PCOS, but they don't tell you what to actually do about it. So let's change that. I want to be really clear. PCOS is not curable currently, but it's very manageable, and here's how. 1. Address insulin resistance first. Reducing refined carbohydrates and refined sugars can genuinely lower insulin levels and reduce symptoms. I'm not talking about starving yourself or cutting out carbs entirely. Please don't do that. I mean swapping white bread for whole grain, reducing sugary drinks, eating protein with every meal. One study of 472 women suggested that a diet like the Mediterranean diet, which focuses on healthy fats mainly through olive oil, produce, and lean meats, reduces a woman's risk of even developing PCOS by 41%. So, small, sustainable changes, not a crash diet. Number 2, movement. Not intense exercise, consistent movement. Even 30 minutes of walking 5 days a week has been shown to improve insulin sensitivity in women with PCOS. You don't need to run a marathon, you need to move your body regularly. 3. Inositol. This is a supplement, specifically myo-inositol. There's actually really promising evidence for it in PCOS. It helps with insulin sensitivity and can improve ovulation. It's not a magic pill, but it's worth discussing with your doctor or midwife. 4. Sleep and stress. I know this sounds basic, but chronic stress and poor sleep raise cortisol, which makes insulin resistance worse. They're not optional extras, they matter. 5. Medical support. Depending on your symptoms, your doctor or midwife might suggest the combined pill. This is to regulate your cycle or even metformin if insulin resistance is significant. If fertility is a concern, there are options, and I'll do a separate video on PCOS and getting pregnant. PCOS can feel really isolating, especially if you've had your symptoms brushed off. You're not lazy, you're not making it up, your body is dealing with something real and it's doing its best, and you deserve proper support. Drop a comment below and tell me, how long did it take you to get your PCOS diagnosis? Because I hear some stories that genuinely shock me. If this helped you, share it with someone who needs to hear it. And please like this video because that lets YouTube know that this is really valuable information. Take care of yourselves, and I'll see you next time.